Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 27, 2025. This video is on a recent New England Journal of Medicine article titled Early Discontinuation of Aspirin After PCI in Low Risk Acute Myocardial Infarction by the TARGETFIRST investigators. Dual antiplatelet therapy duration after percutaneous coronary intervention PCI for acute myocardial infarction remains debated. The hypothesis is early aspirin discontinuation and P2Y12 monotherapy may reduce bleeding without compromising ischemic protection. This is a multi-center open-label randomized controlled trial at 40 European centers, 1,942 low-risk acute myocardial infarction patients post-complete revascularization with drug-eluting stents who completed 1 month of DAPT without events were enrolled. Intervention transition to P2Y12 inhibitor monotherapy versus discontinued DAPT for 11 months. The primary outcome, composite of all-cause mortality, myocardial infarction, stroke, stent thrombosis, or major bleeding. That is BARC type 3 or 5 at 11 months. Follow-up, median 11 months. Adherence assessed at 6 and 12 months. Statistics, power for non-inferiority, margin 1.25. Primary analysis with intention to treat. Hierarchical testing for bleeding superiority. What did they find? The primary outcome, death, myocardial infarction, stroke, stent thrombosis, or BARC 3 to 5 bleeding was 2.1% versus 2.2%. Non-inferior, P equals 0.02. Clinically relevant bleeding, 2.6 versus 5.6, hazard ratio 0.46, p-value 0.002 for superiority. Adherence, 88% at 12 months in both groups. Open label design, selective population, low event rates, underpowered per protocol analysis. Key takeaway, in low risk acute myocardial infarction post-PCI, early aspirin discontinuation is non-inferior to DAPT and significantly reduces bleeding. Clinical PERS, early aspirin discontinuation after 1 month of DAPT may be safe in low risk acute myocardial infarction patients post-complete revascularization. P2Y12 monotherapy with potent agents like ticagrelor or prasugrel maintain low ischemic risk. High adherence, modern stents, and optimized therapy contribute to low event rates. This study supports tailored antiplatelet therapy based on individual risk. This trial enhances confidence in personalized de-escalation strategies in contemporary PCI practice. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.